We shall not be moved, Sweet Honey in the Rock, here on Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman with Juan Gonzalez.
While much of the healthcare debate in Washington and the media has focused on the proposal to create a government-run insurance program, the legislation being considered includes many other provisions that could change how healthcare is delivered in this country. To talk more about the current legislation, we're joined by three guests who have been closely following the debate.
Lois Uttley is the co-founder of Raising Women's Voices for the Health Care We Need. Elisabeth Benjamin is Vice President of Health Initiatives at the Community Service Society of New York. And Dr. Oliver Fein is President of Physicians for a National Health Program. Dr. Fein is a professor of clinical public health at Cornell University and a practicing internist. Elisabeth Benjamin, let's begin with you. I mean, I think if you walked up to anyone on the street and said, can you explain these bills that have been introduced, they would have really no idea. What are the essentials of these bills?
The essentials of the bill, there's sort of four major prongs to the bill, but all of the bills are trying to solve the fundamental problem, which is nearly 50 million Americans do not have health insurance, and 2/3 of all American bankruptcies are related to medical debt. So our healthcare system is in crisis, costs are escalating at a sort of never-ending level, and we need, as a country, to sort of grapple with this issue. So both the House and Senate are trying to push forward legislation through the leadership that contain four major principles. The first principle is that everyone would be required to have some form of insurance. Individuals would be required to carry insurance. Employers may either be required to offer insurance, as the House would propose, or they will be assessed and have some kind of penalty if they don't, as the Senate would propose. And if people do not, as individuals, they will be subject to fines. The second major provision is that there will be an insurance marketplace, an exchange. So right now, you try to buy health insurance on the open market. If you're an individual or a small business, good luck. You will need a broker. The broker gets a cut from the insurance company, so they're not really on your side, and it's very opaque. You can't properly comparison shop. What the exchange will do is list all the benefits that are offered in a sort of comparable way across different carriers. And then the poorest folks will have Medicaid, so they will not be in the exchange, and then everybody who's from moderate poor up to upper income will be able to go to the exchange. But if you have job-based coverage, you just stay with your current job-based coverage. So it's only for people, the sort of 50 million folks that don't have coverage. And for people, because the prices of insurance are so expensive, $12,000 for an individual in New York State, $24,000 for a family on the open market, what the exchange will do is offer subsidies from the government that'll help you buy the insurance products that are offered through there. The third thing that health reform would do is curb the most egregious insurance practices. We've all heard the horror stories about someone with a past history of cancer. That's called a pre-existing condition. They are not offered coverage. The insurers are able to deny that, not in New York, but in other states. That would be eliminated. There would be no such thing as benefit caps. So if you need a transplant, you'd be able, and you hit a $100,000 lifetime cap, that would be eliminated. And the most egregious rating abuses would also be eliminated. And what we mean by rating is they can charge you more if you're older, if you smoke, if you're a family, whatever, they get to charge you more. Those most egregious practices would be curbed. And then the final thing is this whole controversy over the public plan, which I think we've gone into fairly well. The Senate is proposing that states would be able to opt out. That's Senator Reid's most current proposal. And the House is saying, no, we'll just have a national public plan.
But there are 5 proposals now, 3 in the House and 2 in the Senate, and they are vastly different in a lot of aspects, aren't they? Well, they have these basic unities, but then within them, for instance, the amount of premiums that people would have to pay differ dramatically, whether older people would pay higher premiums than younger people also differs dramatically. Can you talk about some of these differences in them?
Well, the House 3 bills have just been consolidated with Nancy Pelosi into one bill. So that what was used to be called the House Tricom is now one, so hopefully. And I think with the introduction of her bill, we will now be subject to floor amendments. You are right that the House bill is different than the Senate bill in the sense that the House bill would offer more generous subsidies to moderate income people than the Senate bill. But at the end of the day, the subsidies are not enough under either bill. And that's because President Obama, in his famous speech after Labor Day, said we can't spend more than $900 million.
Let's go to that clip. This was a speech before the joint session of Congress. This is the part where he refers to the amount of money that we won't go beyond.
Add it all up, and the plan I'm proposing will cost around $900 billion over 10 years. Less than we have spent on the Iraq and Afghanistan wars, and less than the tax cuts for the wealthiest few Americans that Congress passed at the beginning of the previous administration. Now, most of these costs will be paid for with money already being spent, but spent badly in the existing healthcare system. The plan will not add to our deficit. The middle class will realize greater security, not higher taxes. And if we are able to slow the growth of healthcare costs by just 0.1% each year, 0.1%, it will actually reduce the deficit by $4 trillion over the long term.
That's President Obama addressing the joint session of Congress on health care. Elisabeth Benjamin.
Well, the problem with the $900 billion number is that it actually means that we don't have enough to subsidize coverage for folks. If we did a robust public option, we'd grab $80 billion. It now seems like that's off the table. So we need to find the money to have enough subsidies for working people. Why is that? Well, let's do the math. So you have a family of 3 at 300% of poverty. They earn $55,000 a year. They spend $15,000 in taxes. They spend $14,000 in, rent. They spend $20,000 on child care. They spend $7,000 on food. And guess what? They're already in debt. If you add in healthcare costs, which then they're even with the subsidies, they're really in debt. And if they have a medical catastrophe, even with the caps, which is great that they're adding in health reform, caps on your maximum out-of-pocket exposure, you're going to be in debt at the end of the year. And that's the problem. They don't have enough money to actually subsidize people unless they really drive down insurance costs. The only way you really drive down insurance costs is through a public plan, or the other alternative is not even try to do this complicated thing building on the current employer-driven structure.
Which takes us to Dr. Oliver Fein. Dr. Ollie Fein, who is head of Physicians for a National Health Program.
Right, and what we propose is essentially a Medicare for all program, right? Obama had a choice, really. He could have decided to build on what we have, correct? That's what he said he was doing. But he went down the pathway of subsidizing what I think is a defective product at this point, private health insurance. He could have gone down the pathway of taking Medicare, probably the most popular health insurance program in the United States, and saying we should spread that to all people in the United States. And if he had done that, we feel that studies show that you wouldn't have to increase the cost to the middle class. The overall cost to the system actually would be a savings of close to $400 billion per year, mind you. And we've got that money, for instance, because we're spending $1 trillion in Iraq and Afghanistan, okay, per year. So we have the possibility, it seems to me, if we went in the direction of a Medicare for all program, to really make this affordable to all people in the United States. Now, Anthony Weiner from New York,
Congressman from Brooklyn,
Congressman for Brooklyn, Queens, has decided he's going to introduce an amendment to H.R. 3200, the Pelosi bill, in which he would substitute a Medicare for all bill. And this really will give an opportunity for us to see how many people in Congress actually support this approach to reforming health care. We think that there will probably be a substantial number of people that will in fact support this.
But many of the progressives who do support Medicare for all have also said, well, the public option, if we get that, will at least be an entry into a future reform of the system. What's your sense of that argument that they're putting forth?
We're a little bit worried that it's a very puny very weak entry into the field. In contrast to what Elisabeth said, my sense is, and CBO, by the way, the Congressional Budget Office says, that only 10 million people will enroll,